everyone, and welcome back to the Deep Dive. Today, we're going to be diving into some really interesting research from the Mayo Clinic and the University of Georgia about how AI could play a larger role in radiation oncology.
Wow.
And, you might be thinking, okay, but I'm not a doctor, so why should I care?
Sure, right.
Well, stick with us, because this isn't just about radiation oncology.
Okay.
This is a glimpse into the future of AI in healthcare as a whole, something that affects every single one of us.
Yeah. I mean, what's really interesting here is just the amount of data involved in radiation oncology.
Right.
I mean, think about it. Every single treatment plan has to be customized. You have to take into account the patient's medical history, the specifics of their tumor, and the latest research.
Yeah.
It's like solving this high-stakes puzzle where every piece is critical to the patient's life.
Yeah, I can definitely see how that would be kind of overwhelming even for a human doctor.
Exactly. And that's where large language models, or LLMs for short, come in. Think of it like ChatGPT.
Okay.
But trained specifically for the complex world of cancer treatment.
So these LLMs are being trained to almost help these doctors kind of sift through all that data and be able to make more informed decisions.
Precisely.
Okay.
So the Mayo Clinic and the University of Georgia researchers wanted to see if fine-tuning these open source LLMs could improve their performance on 3 key tasks in radiation oncology.
Okay, let's break down this task. What were they actually testing here?
So first they wanted to see if these LLMs could actually generate effective radiotherapy treatment regimens.
Okay.
So that means figuring out things like the dosage of radiation, how many sessions a patient might need, and the precise areas to actually target.
So the AI is essentially trying to come up with a personalized treatment plan for that patient.
The second task they focused on was determining the best radiation treatment modality for a given patient. So this is all about choosing the most effective type of radiation, whether it's photons, protons, electrons, or brachytherapy.
Oh, wow.
Each of these modalities has its own unique properties and applications.
Yeah.
For instance, photons, those are kind of like your standard X-rays.
Okay.
While protons and electrons are kind of like more targeted beams that can penetrate either deeper or shallower, depending on where that tumor is located. Brachytherapy, on the other hand, is more of a localized approach where radioactive material is implanted near the tumor itself.
Wow. I never realized that there were so many different types of radiation therapy.
Yeah.
It's pretty complex.
Absolutely. And then finally, they wanted to look at whether these LLMs could predict what are called ICD-10 codes.
ICD-10 codes?
These are essentially just codes used to classify diseases and medical procedures.
Okay.
And they play a really crucial role in everything from billing to research.
Oh, so it's tackling both the clinical and the administrative side of radiation oncology. Okay, what kind of LLMs did they use for all these experiments?
So they focused on 2 open source models, LLMA2-7B and Mistral-7B.
Okay.
Open source is key here because it allows for transparency and lets other researchers actually build upon their work.
Got it.
Yeah.
So they basically fed these LLMs data from thousands of real patient cases to see how well they could actually perform these tasks.
Right. They trained these models on a massive data set of over 7,900 patient cases.
Whoa.
Essentially giving them a crash course in all things radiation oncology.
Okay, so what happened? Did these AI students pass the test?
The results were actually pretty remarkable.
Oh.
The fine-tuned LLMs, the ones that we specifically trained on this data, blew the vanilla versions out of the water across all 3 tasks.
Oh, wow.
Yeah.
So it really did make a difference when they trained them specifically on that data set.
Exactly.
Okay.
And here's where it gets really interesting.
Okay.
When they looked at treatment regimen generation, over 60% of the AI-generated regimens were deemed clinically acceptable by actual radiation oncologists.
Wait, hold on. Over 60%?
Over 60%.
So that means the AI was able to create a treatment plan that an experienced doctor would actually use.
Yeah. It's pretty amazing. But they didn't just stop there. They brought in 2 radiation oncology residents and a senior oncologist to evaluate these AI-generated plans using a 5-point scale.
So it was a little more nuanced than just a pass-fail system.
Right. They were also looking at the safety, its overall clinical applicability, and whether it aligned with established best practices.
Yeah, that makes a lot of sense.
It wasn't just about the AI spitting out some plan. It was about whether that plan made sense in the real world.
Right.
In the eyes of seasoned professionals.
It's not about replacing those doctors. It's about giving them another tool to help them treat their patients.
But of course, as with any new technology, there are limitations to consider.
Right. AI isn't perfect. What kind of challenges did they face when they were doing all this research?
One of the biggest challenges is this issue of what are called hallucinations.
Hallucinations?
Where the LLM generates output that seems plausible, but is actually incorrect or nonsensical.
So like the AI is seeing things that aren't there?
Not literally seeing.
Okay.
But yeah, it's a good analogy.
Okay.
It's just a quirk of how these models are built. They're based on probabilities and patterns in language.
Okay.
So they can sometimes go off the rails and generate statements that don't actually match the data that they were given.
That's kind of scary considering we're talking about cancer treatment.
Absolutely. Why it's so important to emphasize that this research is still in its very early stages. These specific LLMs aren't ready to take over the entire field of radiation oncology.
Right.
At least not yet.
Not yet. So lots of potential, but still a long way to go.
Yeah.
Where do we go from here?
Well, that's what we're going to be talking about next. We'll explore what these findings mean for the future of AI in healthcare and how this research could pave the way for even more advanced applications.
Ooh, sounds like a fascinating discussion.
Yeah, should be good.
And we're back. Before the break, we were talking about how AI could change the way radiation oncology works, and it sounds like we're really just scratching the surface.
Yeah, definitely. This research from the Mayo Clinic and the University of Georgia is really just laying the groundwork for some more exciting developments down the road.
You mentioned that there were still some challenges to overcome. What are some of the hurdles that researchers are facing when it comes to actually using LLMs in such a high-stakes field like radiation oncology?
Well, we talked about those hallucinations, right? Where the LLMs generate that incorrect or just kind of nonsensical information.
Right.
That's a big one. And researchers are working on ways to make these models more reliable and accurate.
Makes sense. What are some of the strategies that they're using to actually tackle that problem?
Well, one approach is to just incorporate more domain-specific knowledge into the training data.
Okay.
Instead of just feeding the LLM general medical texts,
Okay.
they're starting to include really detailed information about radiation physics, treatment protocols, and even just individual patient case studies.
So it's like giving the AI a much deeper understanding of the nuances of radiation oncology.
Exactly.
Okay.
They're essentially creating a more specialized AI expert in the field.
Okay.
Another challenge is just ensuring that these LLMs can handle the complexity and the variability of real-world patient data.
Right.
I mean, after all, no two patients are exactly alike.
Right.
And their treatment plans need to be highly tailored to their own needs.
So how do they account for those individual differences when they're training these models?
Well, one technique is called transfer learning.
Okay.
It basically involves training the LLM on a massive data set of general medical data first.
Okay.
So that gives it a really broad foundation of medicine, and then they fine-tune it on a much smaller data set.
Of radiation oncology cases.
So it's almost like giving it a basic medical degree and then sending it off to specialize.
Exactly. It's a way to kind of combine the breadth of general medical knowledge with the depth and specificity needed for this field.
That makes a lot of sense.
And of course, we need reliable ways to actually evaluate how well these LLMs are actually performing. Traditional metrics like accuracy are important.
Yeah.
But they don't paint the whole picture when it comes to something as complex as cancer treatment.
So how do they go beyond just simple accuracy to really understand if these models are making clinically sound recommendations?
Well, researchers are developing these new methods to actually assess the clinical relevance and safety of these LLM-generated outputs.
Okay.
This often involves having human radiation oncologists actually review and validate the AI's recommendations, ensuring that they align with established best practices and the patient's specific circumstances.
So that human-AI collaboration is key.
Absolutely. The goal is not to replace doctors, but to augment their expertise with powerful tools that can help them make better and faster decisions.
Okay, so we've talked about those challenges and the ongoing research to overcome them.
Right.
Let's dive into some of the specific ways that LLMs are already being applied to address these real-world problems in radiation oncology.
Okay, so one area where LLMs are showing tremendous promise is in treatment planning.
Yeah, I'm really curious to hear more about that. We touched on it briefly before, but what are some of the more detailed ways that LLMs are being used in that area?
Well, one of the most time-consuming aspects of treatment planning is something called contouring.
Okay.
This involves carefully outlining tumors and healthy organs on medical images.
Why?
It's a process that can take hours.
Wow.
And it's incredibly meticulous. And it's essential to ensure that that radiation is delivered to the right place and sparing healthy tissue as much as possible.
Yeah, for sure.
And LLMs are now being used to actually automate this contouring process.
That's incredible. So the AI is actually acting like a digital assistant almost to help with these more tedious and time-consuming tasks.
Exactly. This frees up the radiation oncologist to focus on the more complex aspects of treatment planning and to spend more time with their patients.
Okay.
LLMs are also being used to analyze patient medical records, pulling out those key pieces of information that can inform the treatment plan.
So instead of having to sift through pages and pages of notes, the AI can just quickly summarize the most relevant details.
Right. It's like having a super efficient research assistant just working alongside the doctor.
Wow.
And because LLMs are so good at understanding and processing language,
Yeah.
they can even generate personalized treatment recommendations based on that patient's specific medical history and the unique characteristics of their tumor.
It really is starting to sound like science fiction.
I know. It's pretty remarkable.
Yeah.
Another area where LLMs are proving to be really valuable is in quality assurance.
Okay.
In a field as precise as radiation oncology. Ensuring the accuracy and safety of those treatment plans is absolutely paramount.
Right. Any mistakes could have some really serious consequences.
Exactly. And LLMs can be used to double-check treatment plans, identify any potential errors or inconsistencies that might have been missed by human eyes.
So it's almost like having a second set of eyes that are scrutinizing every single detail.
Precisely.
Making sure that everything is correct and optimized for the best possible outcome.
Exactly. And LLMs can go beyond just checking for errors.
Okay.
They can also track patient outcomes over time, identify trends, and provide insights that can help improve treatment protocols in the future.
So it's not just about improving individual patient care.
Right.
It's about using this data to kind of advance the entire field of radiation oncology.
That's the power of AI. It allows us to learn from vast amounts of data and make continuous improvements that benefit everyone.
That makes sense.
But the potential of LLMs goes even further.
Okay, where else?
They could revolutionize the way radiation oncologists communicate with their patients.
That's something that I think everybody would appreciate. What are some ways that LLMs could actually improve that communication?
Well, imagine like an LLM-powered chatbot.
Okay.
It can answer a patient's questions about their diagnosis, treatment options, and potential side effects in a clear, compassionate, and personalized way.
That would be incredible.
A lot of patients feel overwhelmed and confused by all that medical jargon and complex information.
Absolutely.
And this chatbot could be available 24/7, providing patients with that support and information that they need whenever they actually need it.
Wow.
LLMs can also translate medical jargon into just plain language.
Okay.
So it ensures that the patients actually understand what's happening.
Right.
And they can actively participate in their own care decisions.
So it's all about empowering those patients, giving them a little bit more control and better understanding of their journey.
LLMs could even be used to create those personalized educational materials for patients, tailored to their specific situation and learning preferences.
This all sounds incredibly promising, but what about the future? Where do you see this technology heading in the next few years?
Well, as I mentioned before, the field is evolving rapidly. We can expect to see even more sophisticated methods for evaluating that LLM performance.
Okay.
So ensuring that these models are not only accurate, but truly beneficial and safe for all the patients.
That makes sense. What about the ethical considerations that we've been discussing? Are there any updates on that front?
Researchers and policymakers are really actively working on those guidelines for responsible development and use of LLMs in healthcare.
Okay.
Issues like data privacy and transparency are at the top of mind.
It's reassuring to hear that those concerns are being addressed.
Absolutely. It's crucial that we use this technology thoughtfully and ethically, ensuring that it benefits all patients equitably.
Yeah, this has been an incredibly insightful conversation so far.
Yeah.
Before we move on to our final thoughts, I want to kind of pause for a moment and reflect on something that you said earlier. You mentioned that the goal isn't to replace doctors, but to empower them.
Right.
And I think that's a really crucial point to emphasize here.
I agree. AI should be seen as a tool to enhance those human capabilities.
Yeah.
Not to replace them.
It's about combining the best of both worlds, the analytical power of AI with the compassion, empathy, and the experience of a human doctor.
That's a perfect way to put it.
Yeah.
It's about creating a future where humans and AI work together to deliver the best possible care for patients.
Absolutely. And on that note, I think it's time we move into the final part of our deep dive.
Okay.
We'll be right back after a quick break to discuss what all of this means for you, the listener, and what the future might hold for AI in healthcare. And we are back for the final part of our deep dive into LLMs in radiation oncology.
It's been quite a journey.
It really has. We've covered so much from the technical details of how these models work to the really exciting potential they hold for the future of healthcare. But now I want to shift our focus to you, the listener.
Okay.
You know, we've talked about the science and the possibilities.
Yeah.
But what does all of this mean for someone who isn't a doctor or a researcher?
Right.
Someone who's simply curious about how AI might impact their own lives?
Well, I think first and foremost, it's important to realize that this isn't just some futuristic concept.
Right.
LMs are already being used in real-world healthcare settings.
Okay.
And their influence is only going to grow in the coming years.
So this isn't sci-fi. This is happening right now.
Exactly. And while we've talked about the challenges, the potential benefits are truly remarkable.
Okay.
We were talking about faster and more accurate diagnoses, treatment plans that are tailored to your individual needs, and even the possibility of preventing certain cancers altogether.
Wow. It's almost hard to wrap your head around all the possibilities.
I know, it's pretty remarkable.
Yeah.
But it's also important to approach this technology with a healthy dose of realism. There are still hurdles to overcome.
Yeah.
And we need to ensure that these tools are developed and used responsibly.
So it's not a magic bullet.
Right.
But it has the potential to significantly improve healthcare for everyone.
Yeah, that's a great way to put it.
Okay.
And I think it's crucial for everyone to be informed about these advancements because they will undoubtedly have a profound impact on our lives in the years to come.
Absolutely. So what can our listeners do to stay up to date on this rapidly evolving field?
Well, there are some fantastic resources available online and in print.
Okay.
You can follow the work of leading research institutions like the Mayo Clinic and the University of Georgia, as well as organizations like the American Society for Radiation Oncology.
And of course, keep tuning in to podcasts like The Deep Dive.
Absolutely.
We are always on the lookout for the latest breakthroughs.
Yes.
And we will continue to bring you insightful discussions on the future of AI in healthcare.
Now, as we wrap up this episode, I want to leave you with a thought-provoking question.
Oh, I love a good thought-provoking question.
Imagine a world where AI is seamlessly integrated into every aspect of healthcare.
Okay.
From the moment you step into a doctor's office to the ongoing management of your health.
That's quite a vision.
It is. What role do you see yourself playing in this future? How do you imagine AI impacting your own health journey and the well-being of your loved ones?
It's definitely a question worth pondering.
Absolutely. And as we continue to explore the potential of AI in healthcare, let's do so with a sense of curiosity, responsibility, and a commitment to using this technology for the betterment of humanity.
Well said. And on that note, we want to thank you for joining us on this deep dive into the world of LLMs in radiation oncology.
We hope you gain some valuable insights.
Yes.
And that you'll continue to explore this fascinating and rapidly evolving field.
Until next time, stay curious, stay informed, and stay well.